Want to welcome our listeners, guests, participants to this webinar room, as well as my panelists, Jessica and Deanna. Please get to the room with me. And I am very excited to kick off this conversation today on a very important and emerging topic that we are going to hear a lot more about. It is about health and well-being coaching. At NYU, we're always trying to stay connected to the most recent and the most current trends in coaching. And this is definitely the area that is exponentially growing, accelerated by obviously the pandemic and the growing awareness within the general population as well as amongst experts of the need for all of us to have a lot more control over our health and well-being. And it's in that spirit that at NYU, we are launching a new health and well-being coaching certificate, as well as including these types of conversations in the series Rethinking Wellbeing at Work. So before we begin, I just want to ask everyone to put your questions in the Q&A tab on the on your lower control bar so that we can address your questions as they come up. And I also want you in the chat so that everyone knows. Just let us know where you're calling from so that we kind of get a sense of the growing community that we have here at NYU. So another point I want to make is this is being recorded, and we're going to be posting, all of you are going to receive a link of the recording as well as the transcript, and it's going to be posted on our NYU YouTube channel. So all of the information will be available and accessible. But thank you very much. We're absolutely thrilled to welcome to this webinar Deanna Fournier from National Board of Health and Wellness Coaching, and Dr. Jessica Singh, our NYU faculty, to engage in this conversation with me about this new trend in this particular area of coaching that is becoming so important. Thank you very much, Deanna and Jessica, for joining me today. All
Thank
right.
you.
So where we're going to start now is, no one, came to this line of work kind of right out of college. This is an evolution, both of you, and I'm familiar with your careers, but I want you to share with our audience how you got to do this important work. And we'll start with Deanna.
Wonderful. Hi, everyone. Thank you, Anna, and all of you for the opportunity to have this conversation today. So my first foray into health and wellness coaching was during my time in corporate learning and development. But I've also always had a special spot in my heart for wellness because I had a rare disease when I was younger, and so being able to keep my health in the positive perspective was always something that I was keen to keep as a theme in my life. But when I was working in corporate learning and development in New York, I saw, there's a tremendous amount of burnout. I took a health coach training program and I saw firsthand how beneficial it was for me. Even with a passion toward health and wellness, I learned so much and took a lot of that learning and implemented that into my training with, with the people that I was working alongside. From there, I started my own coaching business and I worked with a lot of C-suite professionals, as well as in a variety of other places. I went to work for a health coach training program as part of their leadership team, and then moved into nonprofit leadership for the rare disease I mentioned before. And that was such a cool opportunity to bring health and wellness coaching in to support patients and families with the diagnosis as well. And so this opportunity with the National Board for Health and Wellness Coaching really bridged all of those experiences for me. And the thing that I think really stands out is that health and wellness coaching was that missing infrastructure to help with that sustainable behavior change across all these different journeys of my career. And what drew me further into NBHWC, I've been following them for a long time, but was this opportunity to help continue to build the profession. And so I'm really thrilled to be able to help this organization and the field move forward, as well as to be a part of this community. So thank you.
Amazing. And we will go to Jessica now, and I will show how those two paths that both of you took kind of converged in this interesting intersection. Jessica, please introduce yourself and share your story.
Hi, everyone. Thank you, Anna, for this introduction. It's so wonderful to be here. Thank you for joining. I practiced emergency medicine. I stumbled upon this field by accident, as so many people have, or maybe it was just organically an evolution. Somewhere during my emergency medicine residency, it was a 4-year residency, it was a great academic institution. I couldn't figure out why, when I graduated, it was like the biggest accomplishment I ever had in my life. And I was the most unhappy I had ever been. And I couldn't piece the two together. And it wasn't until after my medical residency, practicing as an attending, then doing the first physician wellness fellowship out in California, I learned for the first time about the systems drivers, about the organizational factors, health policy, all these things that contribute to why physicians are so burnt out. And I serendipitously had the opportunity to do that fellowship during COVID. And so it really transformed a lot of how we think about healthcare. And if you're going to do something with your life, I think if people go into firefighting or a police officer and you're more on that really front line, you're ready to risk your life immediately for what you do. When COVID came around and you're working in a hospital, especially in the emergency department, I think every single day was, if this was my last day, is this what I want to do with my life? And so I was really fortunate that the chair of the Department of Emergency Medicine at that time sponsored a pilot faculty group coaching program. And it was my first time ever experiencing coaching. And it was a transformative experience, so transformative that it led me on this path. It was the first time in my life being in a room with attendings of all different backgrounds, experiences in life, and the coach was an external coach. And she held the space in such a way that we were able to communicate and be with each other without this hierarchy, without this cultural expectation of medicine. And the transformations were so profound that I just felt, if someone could do this, if a non-physician could do this, imagine what a physician could do. And coaching just provided such a beautiful way to combine everything I loved about medicine to continue to help healing the healer. And physicians, if you think about it, if you see 20 patients a day, 4 days a year, maybe it's 4,000 patients in a year. 35-year career, each physician directly impacts the lives of over 100,000 people. By coaching them and helping them sustain or figure out their well-being to help treat patients better, that is the scale and impact for that is tremendous. And so being here now, 6 years after fellowship, developing this program for NYU, so excited to have an NBHC approved program, Health and Wellbeing Coaching Certificate, launching this fall as a way to really combine all this beautiful foundation of medical knowledge and coaching to help people who want to become health and wellness coaches.
This is amazing. And again, both of your paths are kind of meeting in this at this interesting intersection between, medicine or health and well-being that is traditionally and clinically addressed through, Jessica, the training you went through and in the residency and actual frontline work in the emergency room. And then Diana, your frontline work in the learning and development field and the training and organizations. And that's how we got here. Now, a lot of people on the call, I'm sure, will be wondering about how this particular coaching skill set in health and well-being, how is it different from, a whole variety of other modes of interaction along those lines of well-being, such as coaching in itself, like ICF coaching. Why would I need to get an additional sort of set of certifications when I'm already an ICF coach? Or, a therapy, which is more oftentimes coaching is often confused with therapy. And even how is it different from training and development? Because we can have a training in a corporate setting on motivation, for example, or team dynamic, etc. So why don't you take turns and explain where this particular skill set sits? We'll start with Jessica, maybe with you, with the medicine, and then with Deanna talking about the workplace as well.
Sure. One of the most liberating things about coaching, especially compared to other fields, when you think about functional medicine or just any field in medicine, is the fact that there are no labs, there's no diagnostics. This is a skill for human communication to where whenever you go to a healthcare environment or if you're working in an organization, there's always a hierarchy. When you go in the room, there's an expert, and then there's someone receiving either treatment, diagnosis, advice. In coaching, the relationship is completely different. Whereas you go into each room where some with the approach that someone does not need to be fixed, that they are wise, resourceful, and whole. And so, this unique skill set for health and well being coaching, one of the biggest differences and assets I find, I'm actually certified in both ICF and MBHWC, is that a key role of health and wellness coaches is also the health educator role. It is very unique in terms of helping to understand what people are coming with. And a very important part is working within scope of practice. So to make sure that if someone's coming in for coaching, for instance, and they have a chronic disease, that they are being cared by their doctor to work as part of a team, to integrate as part of a team. And the National Board for Health and Wellness Coaching has done such an amazing job of making these competencies or code of ethics so that way anyone can learn how to do this, how to support people in terms of making these changes for themselves and accessing wisdom within. Because as we all know, there's so many medical deserts in this country and across the world. And even if you do have the privilege of having access to a physician, what happens all the time when you're at home and not in the doctor's office? So it's so important at any stage for every person to learn these skills.
Wonderful. Really fascinating. Deanna.
Absolutely. And I just will echo what Jessica shared that I think what's so unique as well about health and wellness coaching is that it is structured evidence-based intervention. It aligns with the gaps in healthcare. So supporting individuals and providing accountability for that health behavior change, that whole person well-being. So it's a beautiful piece, but the coaching roles, as you mentioned, do overlap. So there's a variety of different ways to approach coaching. But specifically health and wellness coaching and why it matters, I'll look at the workplace a little bit. It's a skill set that's increasingly essential in the workforce. Some of the core coaching competencies, and even things such as active listening, using, fostering autonomy, facilitating that behavior change. They're similar to the capabilities that organizations are trying to develop within leadership. And that you can look at team effectiveness, learning and development strategies, but also when it comes to thinking about fueling your workforce and nourishing the people that are driving your organization, really helping them to understand that human-centered well-being for not only at work but also at home will benefit the employer as well. And so a lot of employers are looking at health and wellness coaching as a benefit that they can bring into the workplace to say, we really see you as a person and know that what's going on at home may impact how you are here at work, or if you have challenge at work, that can impact you at home. And so health and wellness coaching can be that bridge as well, not just inside the healthcare space, but also in some ways can act as an opportunity to prevent illnesses and things of that nature that might spark from challenges like burnout, for example, that we see so often in corporate environments. And so it's really powerful to see more and more employers are adopting this as a benefit. And with the health savings account or a flexible spending account, you can use those HSA, FSA benefits, or your employers sometimes will offer this through your HR benefit package. And so you can get that right at work or use that, sort of like an employee assistance program where you can call them at any time. There's health coaches now that you can access. And so that overlap, I think, is really beautiful to see and shows that health and wellness coaching really has a place everywhere, which is incredible.
This is such an important point because if we are really looking at people at work, employees, holistically, we've been traditionally just focused on productivity and kind of motivation only in terms of getting them to do more and better and more efficiently, et cetera, et cetera. But especially with AI, I think AI is, and we will talk about technology later, is kind of, shining some light on the specific and unique needs that the humans have at work to be able to function so effectively. And Deanna, you are in a very, you're kind of at the top of the pyramid here now with the national board um, as a leader, an executive in that role. Can you give us a little bit of a sense of how that particular accreditation understanding that there's a separate set of skills that will be required of the professionals in that field. How did it evolve and where are we at right now from the accreditation perspective?
Absolutely wonderful question, and it all started back in 2010 when the founders of NBHWC began discussing the need for standards in the field of health and wellness coaching, and really born out of a desire to see this profession thrive and become accessible for everyone. And what they did was a job task analysis, and from there developed the training and education requirements based off of that job task analysis. And that's something that is replicated over time again to really make sure that we've captured the true essence of the job task of health and wellness coaching. And we decided to do the accreditation piece for programs, knowing that there are programs that existed and wanting to offer that flexibility for people interested in health and wellness coaching to choose a program that really suits their lifestyle. So we have programs that are approved that go from private sector all the way to academic. And as you know, through the NYU's program, congratulations on
Thank you.
bringing that forward. I'm excited to hear more about it later on. But, ultimately, that accreditation is so important because it sets the standard for the education. It defines national standards, but it also is reflected internationally. We have coaches that are in over 50 countries around the world that are NBCHWCs, so they have the board credential. It helps to ensure that defined scope of practice. And then through that, because these programs are meeting that standard and create that consistency and training quality, it builds credibility both in healthcare and policy settings and in the workforce as well. And so more and more employers are looking for the credential because we know that that establishes that baseline foundational knowledge. And the board exam was partnered with the National Board for Medical Examiners because that allows us to go through an incredibly rigorous process as well. So given all that rigor and the standards that these programs will meet, that is why we went that route. And similarly with the continuing education that coaches will take, they also have to be approved. So if we have over 600 courses that you can look through to select for your CE, and you can also petition something of your own. But that creates that trust, and that's part of the we'll talk about this, I bet, a bit later. Part of what is also necessary when we think about reimbursement through health insurance and the payer side is having to have that competency and that standard and that trust in order to go that direction and have that help with the integration into the healthcare setting.
That is such a good point that you're making. And Jessica, a question to you. I'm sure you've been asked this before many times, is like, why do you need coaching certification? You're already an MD. What else is needed if you want to address health, right? Why do you think professionals, MDs, psychologists, etc., nurses, dentists, I mean, anyone operating in that domain would benefit from acquiring these skill sets, and how is it different?
Great question. And this is also in response to what Deanna had mentioned earlier about how specifically what MBHWC advocates for is an evidence-informed intervention. And so when you say coaching, well, what is coaching? Anyone can call themselves a coach. And it's true with most fields, even for physicians. You have people who are trained through medical school, through residency, and then you have other people calling themselves doctor with no education whatsoever. And so
Especially now on the TikTok and internet, there are all of these experts, and we're suffering from it as a society right now.
exactly. And so,
Yeah.
what I really admire that the MBHWC does and did is advocate for defining what is coaching, defining the methodology, and defining the process. So, at least like Deanna said, everyone who goes through, there is at least a methodology that is standardized. Because one of the biggest things is yes, you have the accreditation, it's so important for reimbursement. But what is the big deal with coaching? Why does it matter? How do you even know if it works? In order to demonstrate any research, any evidence based outcome, there has to be methodology. And so, having this credentialing process, having it be standardized, is so key for demonstrating research outcomes. And there's so many more evidence based studies now than there were even 5 years ago, showing the improvements and the benefits of health and wellness coaching, especially for people with chronic disease, cardiovascular health, cancer, preventative health. And in order to keep demonstrating, it's still early though. So, really, in order to keep demonstrating the evidence basis of coaching, we need to have more and more coaches be credentialed, having to have that this process be standardized so that we can help people ethically. That is a big thing to stay within our scope and to help them ethically.
So what you were saying is getting that credential from national board is sending as any certification or credential from the academic institution like NYU, for example. It just sends a signal that this particular individual has gone through a rigorous training process and is not just calling themselves an influencer on some YouTube channel, right? That those credentials really matter because, and we will talk a little bit about the process, but and I know you put yourself through not only top medical school and the residency and the work that you've done, but also through this additional training. And the testimony to that is, the type of work and the quality of work that you're doing now. So we're very excited to have you, Jessica, as our faculty. Um, uh, Deanna, you've mentioned a reimbursement and which in itself, and we can talk about how to do it practically, but I think in itself is a huge recognition because the hardest people to convince that anything needs to be reimbursed is insurers, right? So if it is now a growing and recognized field, not every insurance company is doing it, but could you tell us a little bit about what that process is for you? I'm sure it's one of the priorities for your organization. How does it work, and what will be your recommendations for people who might be seeking these services, and how do they go about getting them reimbursed?
It is definitely a journey. These things do take time, and so there's a lot of work that has been done prior to me joining the organization. There's been a decade of sustained policy, research, and implementation efforts through NBHWC leadership. We do have a practice and research commission as well, which is really focused on building that momentum and advancing the recognition and access to coaching at the national level. And in addition to that, NBHWC is continuing to build on its outreach to employers that are currently employing health and wellness coaching, but also potentially are set up in a way to do so, being at conferences and things of that nature and advocating in that perspective as well. Is the opportunity for employment is one piece of that puzzle. We need the jobs and we also need the reimbursement. And we also know not everyone wants to work in healthcare or will need reimbursement through a payer side. But what did happen in the past is that in 2019, the American Medical Association granted what are called Category 3 CPT codes for health and wellness coaching, which allowed for data collection. And we are still working on moving those to CPT 1 codes, which would be reimbursable. In the interim, we have been having discussions and engagement with Centers for Medicare and Medicaid Services, and that's been actively engaging. We had several conversations. We also petitioned their physician fee schedule last year. year, and over 300 coaches and programs also wrote comments on that physician fee schedule, and the dialogue continues. We have met with CMS leadership and staff multiple times over the past 7 months with formal communication. And what's exciting is that the appetite to have a dialogue is there. And essentially, what we're looking to do is to establish what are called G codes on the Medicaid side. Those G codes would be sort of parallels to the CPT codes and will help with the conversations with AMA to eventually get those Category 1 codes that will be reimbursable. So, and from there, when we have that achievement as a profession, we still have to work with the payers and bring that forward. But I do know that a lot of insurance companies are starting to not only support health and wellness coaching, but they also are bringing them on staff and having that be an opportunity for a benefit through your insurance. CVS Health, for example, has built coaching program in their Minute clinics. So there's a variety of ways where we're seeing this come to life, regardless of having those codes. And then inside the healthcare space, there are over 80 institutions that have implemented and integrated health and wellness coaching as a part of the multidisciplinary team. So you might get a referral from your physician to see a health coach. And some of the things that we're doing more research on are what's the proper dosing of that? Is it, 8 sessions over 3 months? What might that look like? And so building out more of that evidence base off the foundation of the compendium that was published through some of the leaders with MBHWC. So as we continue to do that critical work, part of it is, and what you mentioned, Jessica, is really clarifying the distinction between coaching and other approaches and making sure that health and wellness coaching is uniquely understood. And that way, and creating that consistency of the value, what health and wellness coaching really is, will help us ultimately get there. But it's been a very exciting journey. It will take time, and we continue to feel really positive about the momentum that we see and the conversations that we've been having. So that's what we've been doing. And then I also just want to say, thank you to all of the coaches that are also advocating in their state and local areas. We also know there are other organizations such as the American College of Lifestyle Medicine and a variety of others that are continuing to also advocate for health and wellness coaching in a variety of sectors. And so there's a lot of work being done from multiple angles, which is really exciting to see and ultimately will be what gets us there.
And I applaud all the effort that on your end that goes into re-establishing that recognition, institutional acceptance, and building a network of relationships. And if you can think about this is only barely 16 years in existence. Is that because I think you mentioned 2010 when the MBHWC started, right? The founders came to be. So it's a very, very emergent profession in a sense. And for those of us, and I can see here in the exchange that some of you are saying, I am a certified coach, but it's hard to get a job. And this is where, working in parallel with the institutions and organizations like MBHWC is really, really important. At our conference at NYU in June, we're going to profile a few of these organizations, like the Mayo Clinic, for example. The Mayo Clinic is already integrating these types of services into all of their clinical modalities, and that's an accepted referral. And there will be a whole number of other companies that are operating with NBHWC designation. And if we're thinking about skills that are not going to be replaced by AI, I suspect that this type of coaching is going to be a really important and influential. And Jessica, I don't know if you have, from your point of view, from the kind of coming from the medical background, if you are seeing a level of acceptance growing in the medical profession of this adjacent skill set.
Absolutely. And it's growing across the board, both for providers, for physicians, and for patients. And so, one big example is the partnership that NBHWC has right now with the American College of Lifestyle Medicine. And for those physicians and healthcare providers who take the boards for ACLM to become certified, coaching is a really significant portion of that. And so it's a really essential skill to learn, both to help patients and for providers. Because for patients, if you go to your primary care doctor, maybe they go for a routine well visit once a year. And so if someone has any chronic illnesses, again, going through the whole year in between, how do you help someone improve their goals, help their goals? Integrating coaching into the doctor's office is so key. And not just for chronic care, but for everything, for prevention, for rare conditions, everything. And then on the other side, for the physician side, it's been growing tremendously. So many physicians have been pursuing coach education, despite, like you said, Anna, already going through years of medical school, residency, training, practice, where we are very well trained to have life and death conversations, to deliver bad news. So again, that question, obviously there's something there. If there's a missing skill set as to why physicians are being drawn to practicing coaching and learning coaching skills, because it's something to be added to our additional skill set that no matter what profession you are, you can bring back into your workplace and figure out, this is such a creative time to innovate and really create programs that sustain organizational well-being.
I really love to hear from both of you about the growing recognition because, it's as the saying goes, it takes a village. It really does take a village. We are now finding out the social aspects of health. I mean, it's one of the requirements to staying healthy, longevity, health span, all of these different goals that now our society is pursuing. The ability to connect socially. And this is a conversation that goes beyond the clinical prescription or diagnosis, etc. And as we know, this coaching extends not only in the preventive area, but also post-treatment. One of our students in our executive coaching organization consulting master's degree, Gina Martin, is launching her coaching support nonprofit for survivors of breast cancer. As a survivor herself, she kind of related to that experience that, the treatment was over, her doctors moved on, and she was left sort of disoriented around how do I reintegrate having gone through this life-changing experience. And that's where the coaching comes in. And she herself, having gone through our program, is now setting up the practice. I think she's doing it pro bono to help people, to help survivors. So that's just an illustration of how important these services are going to be, and the importance is going to grow as the recognition is going to grow. And for those of you who are already certified on the call, congratulations. Keep persisting, keep knocking on the right doors, because as I said, the Mayo Clinic is going to come in and talk about how they're doing it. I've heard other organizations. We are now talking to Langone. We'll start that conversation with Langone and our own NYU-based healthcare system to see where these skill set can be integrated. Now, I have a question that is probably top of mind for everyone today, and that is the role of technology. I said that this is a skill set that is not going to be replaced. However, a smart use of technology in this space is going to be a tremendous service and tremendous support for the scaling of these types of services. And Deanna, could you share with us what you're doing in your role to integrate technology into your coaching, practice?
Sure. Well, so NBHWC is absolutely keeping up with what is happening, what the trends are when it comes to how coaches are utilizing technology and where we can see this benefit and this intersection. And as you mentioned, absolutely, those coaching outcomes are still driven by that human connection and accountability, that relational core of coaching. And so that ultimately is such a huge piece of this, technology, it extends reach. So it's accelerating access. We know that there are digital platforms now that will have health coaches on those platforms, which can allow for scalability. I think one of the most exciting parts is that integration into healthcare and workplace systems. You see AI and technology a lot in that space. Enabling data informed coaching. So allowing coaches to kind of have that data from potentially electronic medical records or a learned language model where they're working with the physician as an example to kind of bring that into their coaching practice. But I think hybrid delivery models are being utilized very much across the board for coaches, allowing them to be more human, and to focus on the things that are so important and unique to the health and wellness coaching profession. I know that technology also is allowing for wearables that clients can bring personalized insights about their stress, their sleep, their food choices into the conversations with their coaches. The business foundation piece as well. HIPAA compliance is very critical, but at the same time, being able to have a online platform that you can build your business with. There are several organizations out there that have them built for you, and you can just join and get all the resources that they have. So it's this complement to human coaching, and that's what we're paying attention to, is really just understanding how it's impacting coaching and helping to just understand, as we know, the coaching relationship involves trust, empathy, exploration, and all these components. So what is the role of the National Board Certified Health and Wellness Coach when it comes to scope of practice and code of ethics, and thinking about how that overlays with technology and AI, and making sure that we're keeping our competencies, our scope of practice and code of ethics updated as that continues to evolve. And so is that will help to ensure that credibility and that trust of the coaching profession. And so that's one of the most important pieces for us as an organization as we continue to watch this evolution. And then, of course, as I mentioned in the beginning, making sure that we're standing up and recognizing the importance of the human aspect of coaching. So I know a lot of coaches have asked, will this kind of overtake what I'm doing? And we feel very strongly no. That's not the case, but it's this beautiful complement that can really help the coach in their profession.
Excellent. And Jessica, from your perspective, how are you integrating this technology into your personal practice?
Technology, I think one of the biggest things that I learned from the NYU Coaching Summit is to reframe like our relationship with technology. If there are any biases, to embrace it, to let us help us. And like Deanna said, it's not here to replace us, but we have to be the ones driving and understand. And Anna, I know you teach this and advocate this too at all the NYU events for coaching, and I really appreciate that. For a coach, whether you're working for yourself or with an organization, and in terms of information dissemination and education, it is so helpful in terms of automating tasks, doing things that the human behind it does not really have to do, so you can save your time where it really matters in terms of outreach. And also in terms of even patient care organizations, I cannot tell you how many times when I used to be, when you're in the hospital, you want to explain a procedure to somebody, just even the risks and benefits. They have a standard consent form. But it used to be mind-boggling to me that a provider, a physician would have to take X amount of time out of their day to have the same conversation with someone every time they had to do this. Whereas with technology allows for credible dissemination of information. Also, you have to be careful. Obviously, there's so much information out there that is not credible. And one of the other biggest points for technology, especially, is incorporating it into coaching education. And that is why I'm so excited for NYU's program, because it's really built to help coaches integrate AI, use AI into health and well-being coaching in a way that will serve them.
Excellent. I am very, very excited about this, Jessica. As you know, I keep sharing with you, the impatience, and it took us quite some time, but because the accreditation process is so rigorous, here. I think we're very fortunate to have so many already accredited coaches, and they can help us better understand their experience in the field. And one question we have here is, having received an accreditation, Dana from Kuwait, actually, she's calling from Kuwait. She's saying that she's a new coach, she's completing her accreditation. So how does she go then and get a job and start actually coaching? Because in her Yeah, I know my internet connection is a little bit failing, but the question is, how do you go from the program once you're accredited and start coaching? Because in some parts of the world, in the majority of the countries, this is not yet a recognized profession or recognized practice.
I can start, and Jessica, I'm sure you've got a lot as well. I would start with just first and foremost, if you're looking for collaboration and examples from other coaches on how they've started their businesses, would strongly recommend a networking group or looking on NBHWC's social media and finding some coaches that are interested in collaborating. I think most of the coaches are really collaborative, and having them share their perspective, because there are so many different ways that you can start your business. I would also say, just this is personally for me, when I first started my coaching business, I went to my local community. I went to fitness centers. I went to doctor's offices. And then I also worked within the people that I knew who I thought might be open to the idea of coaching. And I think first and foremost, it was practicing with them. But then I realized that I could start group coaching at a fitness center and would bring people together around a workshop where we'd coach in that group setting, which is it's a unique skill set. But group coaching is one of the trends in health and wellness coaching. A lot of people are really adopting it and finding that it's just a slight modification in some of the skills that you would use. But that shared accountability is phenomenal. And from there, a lot of people will approach you at the end and say, "This has been great, and I really would like more of this. How can I learn more about working with you?" And then you might get some one-on-one clients from there. So just as an example, but I think figuring out what is uniquely you and what you bring to your coaching business is one of those, key selling points of being one of your clients. So I would say start with who you know in your network, and then there's also other approaches. You can certainly go on social media and build a business that way. Probably a little bit more challenging to find those clients, but there are coaches that have something unique that will bring people in around a particular area that they're familiar with. But really, you can coach anyone. So I would say collaborate with other coaches and see how they've started their business. And we know that building the business and the marketing aspect is often this huge other piece to the business. And so what NBHWC has been doing is starting to kind of expand some of our NBHWC sponsored CEs and offer some more of these conversations. So if you are already an NBCHWC, you can attend those for free and get CE credit. If you are not yet board certified, you can still join the conversation. There's a small fee to join those talks, but you can participate in those. And we recently have done multiple on marketing and business because we know that it's so important. So, and then also there are CEs that you can take that are focused on the marketing and business piece. Definitely, it's something to hone in on. And so, if you have questions about kind of getting patched in, feel free to reach out. But I'm sure Jessica also has some wonderful ideas, so I'm going to pass over to you.
Thanks, Deanna. I appreciate the advice that you shared. I think one of the most important things to understand is transparency. So at least, Indiana, please chime in. For the National Board for Health and Wellness Coaching, they are certifying accredited NBHWCs who meet the standards, right, that they say. But it's not, people often think that, okay, once I get my certificate, I'll get a job or I'll make a living. And those two do not equate. It would be the same as if in any field you go into, thinking that when you graduate and get your diploma, it guarantees a job. That's not how it works. And so it's really important to be transparent about that from the beginning. And like Deanna had mentioned, thanks to technology, we can learn from each other. Other platforms to work in is so not starting where you know is amazing advice, but also what is your why? What is the impact you want to make? What is the change you want to make? and making a business plan. If you want this to be your only form of income, what do you need in order for that to happen? And for some reason, if some people aren't so keen on the, I don't want to necessarily be an entrepreneur, I just want to coach. There are large coaching platforms and organizations that are also looking. I know, for instance, Better Up, Better Care. There's so many online platforms working directly for a healthcare system or organization. As the accreditation becomes more popular, more well known, more jobs open up. One of the benefits too for being credentialed is MBHWC has a job board that we have access to, and they've had incredible opportunities. So it's really important when you go through to acknowledge the training for what it is. You are going to get a great skill set that will most likely change your life in some way. It's hard not to be transformed while learning how to be a coach, but it's also important to realize that the business aspect of it, how to make a livelihood out of it, is not actually within that scope of credentialing.
And that is something that we definitely will continue to evolve and add to all of our credentialing right now, because we do feel sort of responsible for at least telling people how they can get to where they need to get. And my own personal observation, and just the cases at this point on the receiving end of these services, is that I would go to coaches that are specialized. And the example of Gina Martin, I mean, she found a space that she's so familiar with, having a lot of empathy because she's gone through this experience herself, and that's where she's developing her business. And anyone who's gone through that experience can reach out to her and receive that support and service, etc. So that's where I think one of the areas that identify, even if it's not recognized in your country, identify the area where people need help most. But it's not really about you. You know, we tell it in any business class or coaching or consulting. It's about your client's issues, and your skill set has to be relevant to the solution. But anyway, this is a really, really exciting. And this is just the beginning of the journey. We're going to have multiple conversations, obviously our conference in June. But to come the full circle, sort of to the beginning of our webinar here, where do you see the future for yourselves? You know, you've already accomplished so much, and in terms of credentialing, et cetera, where do you see your future with the center skills in this type of coaching? Where is it going for you, and what are you doing for it? Just share your plans a little bit. We'll start with Jessica and we'll end with Deanna.
One other way, and it goes with this question, is so for coach training and education, this is one of my favorite parts about the health and wellness coaching certification. So this program at NYU has been such a gift. So when you think about the future, about change and impact, building educational programs, being involved in that part is such a key part for me. And it's really that piece of medicine that carries into coaching in terms of teaching. And so for any coach who's already certified, if you like to teach or education, building programs or these things in organizations is huge. And so basically the vision that I hope to do is to continue to bring coaching to those who need it most. For me, which is everyone, but for me, I have a special place for medical students and physicians in training.
Amazing. So in addition to our students who are not medical students, we're going to again do this outreach to NYU Langone system, which I think will be incredible. Deanna, what about you?
Yeah, absolutely. I mean, there's such rapid movement and growth of health and wellness coaching, and Jessica, I agree. I mean, being able to continue to see, these education programs come to life, especially at an institution like NYU. I mean, that's phenomenal, and I think that this will just continue to expand the reach and opportunity. And I love that there's so much focus at NYU on health and well-being for people that are engaged with you and beyond, because it sets a precedent, a tone. I know a lot of people look to NYU and as a leader, and so to see that being developed and thriving is incredible, and just really, really exciting. So again, Jessica, thank you for the hard work that you've put into it, and for everyone for bringing this to life And, we have 145 plus approved training programs at NVHWC. And I know that people look for which ones have this high caliber that, I can really turn to and know that I'm going to get more than the 75 hours of training and really build on that and develop. And as you mentioned, Anna, being able to kind of expand the support that you offer to students that are coming through program is incredible.
Yes, because as you know, we have expertise in marketing and entrepreneurship and technology, et cetera, that are adjacent. And we definitely have a lot of resources to support the students who will go through this program. But at this point, I just want to thank you so much. This is an important conversation. You have my commitment that this is just the beginning of the journey we're on. There will be a whole series of these conversations. We want to encourage all of you who are staying on the call to continue joining these discussions. And if you want to meet with Jessica and Deanna in person, join us on June 15th, 16th on NYU campus in New York City to dive deep into the conversation about these types of issues, as well as the technology that's going to support us scaling these types of skills. Thank you very much. Again, you're going to receive the recording. And then there are some dates coming up. Tomorrow, actually, we're going to, for those of you who are not yet certified, we're going to have an information session with Jessica. And there's going to be a whole series of other sessions that are not exactly and directly related to healthcare coaching, but address issues of well-being at work in many different ways. And most importantly, if you are available and can make it to New York, we would love to have you join our community. Thank you all so much. We are delighted to have you on our team, and stay tuned and stay healthy. Thank you very much. Bye-bye.